Okay, we're waiting for everyone to come on. We'll see. There we go. We are live. Hi, everybody. My name is James Marin, holistic registered dietitian, environmental nutritionist.
I'm Delia Marin, registered dietitian nutritionist.
And welcome. So if you're watching this, you're probably watching this in our Good Gut membership group. That is a private group, which you can find information on that at marytout.com. You're also probably seeing this on our YouTube channel. So if you want more information, leave a comment below or also go to marytout.com. Today, we're going to be talking about SIBO and IBS and how for the past several years, really, we've been treating SIBO and IBS and how we do that a little bit differently than what's the norm out there. Right, Delia?
Yes, absolutely. And we really found a need to create our unique program and our unique protocol with our community. So those who are on a plant-based, plant-forward, vegan diet, we know that those who were diagnosed with SIBO, small intestinal bacterial overgrowth, or irritable bowel syndrome, and who are vegan, vegetarian, or very plant-forward, were recommended to go on a low FODMAP diet. And we've had this time and time again. I've had so many patients come to me and say, one, either they have such a limited selection of things to eat on a plant-based diet that they felt they weren't getting the nourishment they needed. Two, others felt like it didn't work for them. I had so many patients tell me, I tried going low FODMAP and I didn't really feel much better. I might have felt a little bit of a difference. It does work for many people. It doesn't work for everybody. And it's not a long-term solution. So we also had many people come to us saying, yes, I went low FODMAP. I went the traditional route. I felt better for a little bit, but now it's a year later, 2 years later, and I only eat 10 different foods and I'm still not better. My SIBO is still here. I'm still not in remission, and I need to figure out another solution.
And so it's really thinking about this in a really logical and simple way. We're looking at this as, what's out there is telling you to eat less of these foods that make you bloated, take more of these supplements, or take these medications that eradicate bacteria. And really, those are just quick fixes. And when you think about it logically, those things don't make sense, especially long term, because you're eradicating bacteria. Some are bad, but a lot are good. And a great analogy that we give for this is an ecosystem, right? There are hyenas. Do you want a hyena in your bedroom? Probably not. There are rats. Do you want a rat in your bedroom? Probably not. But those animals are vital members of an ecosystem, just like bacteria and protozoa and fungi even. I know everyone's like, oh my gosh, I have a candida overgrowth. And really with SIBO, it's IMO, right? Intestinal microbial overgrowth is another term for it because there's a host of microbes that can be not really overgrown per se, but in the wrong place, right? So just like you wouldn't want the rats and hyenas in your bedroom, but they're fine outside in Africa, or in the wilderness doing what they need to do. So that's the same idea with SIBO and even IBS. And just to clarify the two, not all IBS is SIBO, but all SIBO is IBS technically, right? So I even had to make sure I said that correctly, but I know it can get confusing with all the acronyms and things like that. But it's important to realize that in many recent studies, they showed upwards of 40% or more of IBS cases actually had SIBO as well, so small intestinal bacterial overgrowth. So it's important you understand, it's important you're working with the care team that gets to the root causes. And for those of you in the group, amazing, welcome. And you guys you're seeing this live, you get to ask your questions right now live. So we'll get to some of those questions. For those of you watch on YouTube, again, you can click and figure out how to maybe work with us or get into the group because we are here to support. We've realized that SIBO and IBS needs a lot of support. It's not just, here, take this pill. All right, bye. It's a lot more than that.
We know that up to 60% of those who do even get diagnosed with SIBO, we know that diagnosis rate can be a little bit on the lower end. Not everybody reaches a diagnosis very quickly. A lot of people suffer for years before they're diagnosed with this intestinal microbial overgrowth or bacterial overgrowth. And so those who do get diagnosed are oftentimes then recommended to take antibiotics or maybe even some antimicrobials. And what makes us unique is that we do encourage everyone to work with your care team. And your care team can look like many different people, but we want you to work with your care team to try to identify all of the who, what, when, wheres, and hows of your SIBO. Why did you get SIBO in the first place? How did you get it? When did you get it? How can we prevent you from getting it back? Some studies estimate that up to 60% of those who are diagnosed with SIBO and treated with antibiotics alone will relapse. So they'll have symptoms recur once again, oftentimes if the root cause of their intestinal microbial overgrowth is not addressed. And like we said, that can consist of many members of your care team addressing different symptoms that you might be having, which we'll get into symptoms. Because you might be hearing this and you might not have been diagnosed with SIBO, or you might have been diagnosed with IBS and you're not sure what SIBO is, and you're not sure if you have SIBO. So you might have been diagnosed with IBS and you might be experiencing things like gas and bloating. One telltale symptom that a lot of our patients with SIBO will say is they wake up with a flat stomach, and as they start eating and drinking, even if it's just water or tea, they become increasingly bloated. By the end of the day, they are so bloated that they look and feel 6 to 9 months pregnant. That does not always indicate SIBO, but oftentimes it can be a symptom. Other symptoms can be alternating constipation and diarrhea. Maybe throughout the day you're experiencing both. Maybe one day you have diarrhea, urgent bowel movements where you're like, oh, gotta go. Then the next day you're sitting there on the toilet straining and you're struggling to pass a bowel movement. We know that reflux can be a big symptom of bacterial overgrowth, because when you are that bloated, you're usually pressing on your stomach and that stomach acid's coming right back up. Sometimes patients aren't as gassy. Maybe they're not passing excessive gas more than 15 times a day. Maybe they're belching and it's coming up the other way. So these might be indicators that something could be going on. It could be IBS, irritable bowel symptoms of irritable bowel syndrome, or it could be something deeper where there might be a microbial overgrowth, an over-inoculation of microbes in the small intestine where they don't really belong. And you see here, we're sitting in front of these really pretty pictures. Love sitting in front of these because we're gut obsessed. But as you see here in the gut, everything's connected, mouth to anus. It's all connected. It's one big, long organ. And so when we're eating, when things are moving and flowing correctly, there is kind of a rhyme and reason to everything. We're starting digestion in our mouths, where we're releasing saliva and digestive enzymes in our saliva. When we smell food, we're starting the digestive process of preparing stomach acid and producing also enzymes, pancreatic enzymes and other digestive enzymes. We know that once we do that, we start chewing the food and breaking it down. That's digestion. And so start there. How's that going? We swallow food, it goes down the esophagus. And although everything's connected, it's compartmentalized. We have different doors that are separating different areas of our digestive tract. So that esophagus has a little door, a sphincter that opens up. It lets the food, now that's been chewed up and broken down a little bit, hopefully a lot by us if we're chewing thoroughly, pass into our stomach. And our stomach is releasing that beautiful, amazing stomach acid, which we need. And we really need to be breaking down our food correctly with stomach acid. And our stomach acid helps break down so many other things, right? Like bacteria, viruses. It's one of our first lines of defense in our immune system. So if you have been put on a proton pump inhibitor or an antacid for months and years, it's always important to kind of look into that a little bit more, work with your care team.
Comment below if you've ever been on a PPI, a proton pump inhibitor. I bet we'll get lots of comments.
And oftentimes, they can be indicated, they can be warranted, but I don't really think that long-term use is always the best solution if we can't figure out why. Can't figure out why you're having reflux. So working with your care team on that. We want that stomach acid. It breaks apart our food. The next place that our food is going for best, most optimal digestion and absorption is our small intestines. We have our beautiful small intestine that we see here. We're doing most of our digestion and absorption there. We don't have a lot of bacteria living there in the small intestine. They estimate that there's about 10,000 bacteria per milliliter of fluid in the small intestine. That's not a lot. Whereas in the large intestine, the next little door, there's about 1 billion. And so we know there's a lot more bacteria, viruses, microbes. There's a lot more little guys living in the colon, the last leg. That's a significant amount. So with SIBO or intestinal microbial overgrowth, what happens is some or many of those microbes living in the colon they'll get hungry, they'll become impatient for whatever reason. Maybe it's due to extreme constipation. Many reasons. We'll be covering that in another video. They're migrating into the small bowel, the small intestine. And that's why people are feeling so gassy and bloated.
Mm-hmm.
They are a lot. There's a lot of microbes, right?
Yes.
And they are doing their right job in the wrong place. They're fermenters. So we have all these amazing microbes that are doing fermentation. They're practicing fermentation. That's supposed to happen in the colon, right? That's that last bit of digestion that we do. We ferment things to glean benefits. So we want them to do that. We just don't want them to do that in the small intestine, because when it's happening there, you're fermenting. And what happens when we ferment stuff? We produce gas. So if you're waking up flat stomach, but you start eating and drinking super gassy and bloated, and by the end of the day, you feel like a balloon that's about to pop. I have my patients tell me these exact things every day. So that could be an indication that something's going on. Could be some type of microbial overgrowth.
And so the big question is, what do you do? Like, how do we treat this? You know, what the heck do I do with these bacteria or fungi or other microbes that shouldn't be where they are? How do we get them back where they should be? What's going on? And so the quick answer to that is working with a care team that can help you understand these root causes. Because just like a tree, there's not just one perfect root and that's all the root. You know, that's all it is to a tree, right? You see a tree and there's multiple roots.
There's a network.
There's a network. So in a separate video, we're going to get deeper, like Dahlia mentioned, into that network of all these different root causes and what can be going on. So it's important. And many times, I mean, in our experience working with patients, our patients suffering with SIBO and or IBS have multiple specialists on their team, because there is, you know, a multifactorial approach needed to get to that root. But one of the big ones, and why we're here, why we're talking to all, what we specialize in is nutrition. And so it didn't make sense to us really for people long-term to be eating 5 or 10 different foods, right? It doesn't make sense. A low FODMAP diet is not a long-term diet, right? Anti-lectin pills or oxalates and salicylates, these things are not your enemy. Okay, so it's important to understand that the approach to SIBO is not to limit for a long time. It's to say, okay, what are your root causes? How do we reintroduce fiber and foods? Because fiber is the key, and retolerate. So that is one of the big keys to success.
In addition to having a dietitian on your care team, and we'll go in depth with this again in a future video, but we suggest that you also have a primary physician on your care team. That could be a gastroenterologist who is also your primary physician if they're also an internist. For some of you, you might have diabetes, you might require an endocrinologist, you might have pelvic floor issues and
thyroid disease,
yes, and require an endocrinologist. You might have pelvic floor issues and benefit from having a specially trained physical therapist on your care team. It might be very stress involved, so having a therapist, a counselor, a psychologist on your care team can be beneficial. There are so many important members who can be on your care team to help you really get ahead of this. And again, once and for all, have this be the last program that you try. Have this be the last specialist who you see, or, nutritionist, dietitian, someone who you are working with to get to the root.
And we could talk forever on this, guys. So that's where we're going to break it up. And we're going to be going live twice a month. So every other Friday. So not next week, but the week after. So stay tuned. Make sure you're subscribed. Make sure you're in our group. If you're in our group, you're going to get all these notifications as well. But I want to get to some questions we have, because we can keep going and going. This could be a 45-hour long video. But we have some questions. So one of the first questions is about stool testing. We get this question a lot through our DMs on Instagram, through our patients and our patient portal. So
yes, we oftentimes are either asked if we do stool testing. We recommend that patients do stool testing, or sometimes my patients tell me, I was diagnosed with SIBO via stool test. One, that's not quite how you diagnose any type of microbial overgrowth. The two best ways to get a diagnosis for your small intestinal bacterial overgrowth or any type of microbial overgrowth would, one, gold standard, to have a gastroenterologist who can do a small bowel aspirate, meaning during an endoscopy, they're getting some of the fluid out of your small intestines, so that way they can test that. that is the best way. We know that's in very limited supply. Not everybody's able to
It's not very
offer
practical.
that. Yes, and it's not very practical, and it's invasive.
And there's also some research showing that, when you're getting that aspirate, you're getting it from the upper small intestine. A lot of times, a lot of these issues can be in the lower right area of the small intestine. So
it could be a way that you go to get your diagnosis. The way that we usually are helping patients try to figure out what's going on is we order a breath test. So we are looking for excess gas through patient's breath. So it's not only a test that you can safely do at home. You get shipped a kit to your house. You're doing it yourself. So you want to be very prepared to do that for yourself. But it's one also that's less invasive. So we'll talk all about that again in a future video where we're talking about how do you get tested. It is important to get tested because you don't want to be trying to treat something that you don't actually have. So you want to actually know whether or not you have SIBO or whether or not you have some type of microbial overgrowth. So SIBO is diagnosed via breath test. To diagnose fungal overgrowth, that would require a small bowel aspirate through an endoscopy. But we recommend doing these. Stool tests are not a reliable way to diagnose SIBO. We oftentimes have patients come to us, they've spent $400, $500, $600 on a stool test, and they tell me, I have E. coli, I have all these different things, I have Shigella, I have all these things. These can be normal parts of our
Which
stool.
Going back to the original example, if you guys watched the original example, or depending when you're coming in live, but rewatch this video if you missed it, again, that's like saying, oh my gosh, the forest has rats. Yes, the forest does have rats, right? Oh my gosh, the jungle in Africa or the savanna in Africa has hyenas that can kill you. Yeah, they sure can. But again, it's the right place at the right time where these animals are, and that's where we want to leave them.
And with these stool tests, again, that's mostly assessing what's going on in your colon. So you should have bacteria and other microbes in your colon.
Right.
So if somebody is trying to tell you that they're diagnosing you with SIBO based on a stool test, that's not an accurate way to be getting that diagnosis. And we just don't feel like the technology is quite there yet for stool testing. So a lot of these different companies offering you diets based on stool tests, there's not great data to back it up.
We'll maybe do a whole video
We'll do a whole
on stool tests.
So stool test, how do we feel about that? Not great. So that's not part of the program. We don't recommend stool testing. We talked about breath testing. That was another question that somebody had. Do we recommend breath testing? And we do. And so that is something that we're able to offer with breath testing. We're looking for 3 different types of bacteria, or 3 different types of gases, rather, produced by 3 different types of bacteria. We have hydrogen, we have methane, and we have hydrogen sulfide bacterial overgrowth that can potentially be going on. So with a breath test, the one that we use, it tests for those 3 types of bacterial overgrowth.
Yes.
And the gases that they produce.
Yes, you answered the second question we're saying. And then the third is food sensitivity testing. So lots of like, should I take a food sensitivity test? We get lots of those questions. What sensitivity testing should I do? And what does it mean? And so, so overall, when you're highly sensitive to food, you may even have food sensitivities and food allergies. That roughly means you have gut permeability happening. So
leaky gut or intestinal hyperpermeability.
Right. So those are all fancy names for leaky gut. And essentially leaky gut is these food proteins are bypassing the barrier of your gut, which is the healthy functioning barrier that we want intact and very vibrant and healthy, right? Otherwise, you're leaking these proteins into your bloodstream. It's not just your bloodstream. It is literally your nervous system. It is literally your autoimmune system, or I should say your immune system, which can give an autoimmune response. So this is this inflammatory response when large molecules are going where they shouldn't go. They are deemed foreign invaders. They are deemed foreign, and your body signals to attack.
So a lot of times food sensitivity tests are done via blood. So really all that's telling us when somebody brings me a food sensitivity test is you have leaky gut. If a lot of foods show up on your food sensitivity test, it means you likely have some type of leaky gut or dysbiosis. So maybe an overabundance of inflammatory bacteria and underabundance of anti-inflammatory bacteria. And that might have triggered leaky gut. Many things can trigger leaky gut. Another video we'll get into. But the food sensitivity tests don't necessarily tell you what triggered the issues. Oftentimes, my patients who have had food sensitivity tests done come to me nearly in tears and say, this is everything I eat that showed up on this test. Well, of course, if you have leaky gut and you're leaking food proteins into your bloodstream, it's a memory. It's an immune memory that your body is noting on this test that it's come into contact with this food before. So it doesn't necessarily mean that the oats and the bananas and, the walnuts that showed up on that test, you're highly sensitive to. Maybe you just ate them the day before and you have leaky gut. So again, save your money. I don't really often recommend food sensitivity tests. It's very rare that we will run these tests. We can order stool tests, we can order food sensitivity tests, but we help our patients identify where their time, their effort, their funds are going to be best spent, because we've seen them take people down an unhealthy place where then they say, okay, then I can only eat these 8 things and this is all I'm going to eat.
And this is in no way medical advice. This is just our opinion. This is from years and years and years of experience, and we're just sharing.
And studies.
And studies
all
as well.
The most up-to-date literature.
But you got to do what's right for you. Work with your care team. Look into this further. If you want to visit our website, you can work with one of us. We see patients all over the world, in the United States as well. And this was great. Wonderful questions. We love speaking and talking with all of you, and we're so glad you made it today. Tune in 2 weeks on Friday at 4:30 p.m. Pacific Standard Time. We'll be back live on another topic that has to deal with your gut health, and most likely SIBO, IBS, the gut microbiome, all that good stuff having to do with gut health. So thank you all so much. We will be talking to you soon. Again, my name is James Marin, Holistic Registered Dietitian.
I'm Delia Marin, Registered Dietitian, and we are grateful to be part of this journey, and we hope that this is the healing end of it.
Bye, everybody.
Bye.
See you next time.